This is a very complicated case. This is the best case scenario. Looks fantastic.
Definitely go to Dr. Barrett.
Everybody, our patient today, she's had multiple breast operations. I'm going to kind of narrow it down to a couple of the main things. She has a lot of pain in here from a transaxillary approach. That's why I don't like armpit approach for the implants, because there's a lot of nerves that can get disrupted. But you can see also that she has a double bubble here, right? So that's when the implant kind of gets pushed down. Doctors try to lower the fold, and what happens is the implant goes down and then the breast goes up. So if you come in really close right here, so that's implant, that's breast, and there's this little groove right here. She's had that ever since she was younger. So we're going to bring that back up. We're going to remove some of that capsule. We're going to repair that pocket, put a brand new implant in there. We're going to have to make a peri-real incision because it's got to do a top-down kind of cleanup approach, and we'll get this all taken care of for her, so stay tuned. Okay, so we are expanding the pocket here immediately so that when we tighten up the bottom part, it's going to go up. It's looking really good inside here. So we're just sitting up here right now. We have 485 sizers in place, and we did a partial capsulectomy on this side. It released it a lot. So we're sitting up to really kind of dial this in. We got to do this back and forth a few times, but you know, we're headed in the right direction here. This is a very complicated case. Our next step is we're going to do a little pocket repair. See this part? It's still bulgy right here. So we're going to tighten that up there to see that, get rid of that double bubble right there. Complicated breast case, you guys. So we did removal of our implants. These are the implants right here. We did a capsulectomy on this left side. We repaired that double bubble on both sides, and we expanded her cleavage. We did a little internal tightening as well. We increased her size from 445 to 485, and we're able to all make it happen. She's going to wear a bra for 6 weeks. If you have asymmetrical breasts or you have capsule contracture, there are options. We can do other implants. We can do fat transfer. We can do lifts. We have lots of things that we can do. So if you're interested in any of those types of things, please give me a call, or you can check out our website, drdanielbarrett.com. Thanks for watching, and feel free, as always, to leave any comments, questions, feedback you have right here on the page. And don't forget to give me a thumbs up and hit subscribe if you want to see more cool surgery videos just like this. Thanks so much.
The recovery went really well. It was really easy. The hardest part is just being a mom, you know. It's an easy thing to get through once your kids understand, you know. It didn't take very long for them to understand what was going on, and then everything was smooth. Definitely take time for yourself. You're worth it. The results are really good. I'm really, really grateful because they were really, what do I call them? I don't know. They weren't good. Let's put it that way. So they're much better. So I'm very, very grateful. Definitely go to Dr. Barrett.
So we did a revision on the left side. We did a capsulectomy, and we did a pocket repair on this side. So the key thing is that this is now lined up. We have beautiful finger space cleavage, matching size, no more tightness on that one side. So this is the best case scenario for capsulectomy after capsular contracture. Do know that we can get results like this. If it's done properly, you got to get all that capsule out, get it fully clean, and then put the implant back in. So this is a beautiful 4-month result. Looks fantastic.